So, hi, Dr. Abrams.
Hello, everybody.
Hello. Hi.
How's everybody doing today? Eating well?
Yeah, most of the time.
Huh?
Most of the time. Yeah.
If y'all know Urban Remedy,
Yes.
Mm-hmm.
yeah, I've just started one of their matcha bars, which is green tea and chocolate or whatever, but no sugar. Amazing. So it's going to energize me as we go. So today we're going to talk about supplements, including cannabis. And as I think I made clear last time, I believe that most of our nutrients and supplements should come from the foods that we eat. But there are some products that I think are useful and valuable to maintain health and well-being. So vitamins pop to mind as things that must be really good for everybody. And in fact, I am not a fan of multivitamins. For people who eat well, I don't think a multivitamin is necessary because I think multivitamins contain some things that may not be beneficial to all people. For example, let's start with our ABCDs of vitamins with vitamin A. There was a belief in the old days that vitamin A could decrease the risk of lung cancer in people who smoke cigarettes. So they did a very large clinical trial. Over 30,000 men who smoked cigarettes were randomized to beta carotene, which is a vitamin A precursor in foods like carrots and squash and sweet potatoes, those things that are sort of yellow-orange, or vitamin E, or both, or neither. And they were followed for a number of years, and the study was ultimately stopped because the men who were randomly assigned to get the beta carotene actually wound up having an increased risk of lung cancer. That study was repeated in two other large studies of over 30,000 people, and beta carotene, vitamin A, increased the risk of lung cancer. There was a suggestion in that study that vitamin E might have decreased the risk of prostate cancer. So they did a large study in 20,000 men over the age of 55, and they gave them vitamin E, selenium, both or neither, to see if they could decrease the risk of prostate cancer. And that study was also stopped early because it didn't look like it was going to decrease the risk. And in fact, at the end of the day, the vitamin E increased the risk that men were going to get prostate cancer. Well, now that's pretty weird. Why would that be? So in nature, vitamin E lives in 8 different forms: alpha, beta, gamma, and delta tocopherol, and alpha, beta, gamma, and delta tocotrienol. And when you buy a multivitamin or even a vitamin E supplement, it's usually just the D-alpha tocopherol. And so if your body sees that you have 400 times the daily need of that vitamin E, it's not going to absorb the gamma tocotrienol, which may be actually what decreases the risk of cancer. So in that study, the selenium also wound up increasing the risk of both diabetes and more aggressive prostate cancer. So being a man who used to smoke cigarettes and who still has a prostate, that's why I won't take a multivitamin, because it's going to give me vitamin A and vitamin E. Now, those are two so-called fat-soluble vitamins, which means that if we take too much, it gets stored in our fat instead of us peeing it out. A water-soluble vitamin are the B vitamins. And they did a study in Sweden, or Norway, I think it was, in Scandinavia. In this country, we fortify baked goods with B vitamins so babies are not born with neural tube defects. They don't do that in Scandinavia. So they did a large clinical trial, again, where they gave older people with heart disease vitamin B6, folic acid, and B12, all 3 of those, or all placebo. And there were about 2,500 people in each group, followed for a number of years. And at the end of the day, the people getting folic acid and B12 had more cancer, more death from cancer, and more all-cause mortality. Well, personally, I think B12 is good for us, especially for people that are vegan or don't eat much animal products. It's important for our nervous system. I think the bad actor in that study is folic acid. Folic acid is a synthetic form of folate, which is what we get from foliage, our green leafy vegetables. And I think folic acid allows for precancerous cells to continue to divide and ultimately become cancer cells. So that, I think, is the lesson from that study. And we have found that men who supplement with folic acid have a greater risk of prostate cancer. So B vitamins, even though we think if we get too many of them, we'll just pee them out, can cause problems too. Another reason I'm sort of against a multivitamin. Now, one fat-soluble vitamin that I'm fond of, however, is vitamin D. D is in Donald. That's not why I'm fond of it. Vitamin D, as you know, is the one that we get from the sunshine. It's not really in many foods. The foods that it's in it's basically been fortified with vitamin D, and they are milk and orange juice predominantly, and I mentioned both of those last week. Vitamin D is also present in, interestingly, deep cold water fish. And I think I mentioned as well that if you take raw mushrooms and put them outside in the sun for 20 minutes, they will produce vitamin D2, which is different from vitamin D3, the more active form that you usually get in your little supplement. So low levels of vitamin D put people at greater risk for a number of cancers. And people with cancer whose vitamin D levels are low, in general, don't do as well as people whose vitamin D levels are normal. So the only blood test that I look at in patients that I see here is vitamin D, and most people are deficient. Actually, the Institute of Medicine in one of its less wise phases actually changed the lower level of normal from 30 nanograms per milliliter to 20 because so many Americans were abnormally low or deficient, so they decided, let's just lower the range of normal. Again, vitamin D comes from the sunshine, but all of us are fearful of the sun because of our buddies, the dermatologists, who tell us, you know, put on sunscreen. When we're over 50, overweight, or more pigmented, we also become vitamin D deficient. In general, when we learn about vitamins in elementary school, vitamin D deficiency was associated with rickets, those bow-legged children of whom I've never seen in my 40 years of being a doctor. But vitamin D is also important for bone health in adults. And low vitamin D decreases the calcium in the bones and leads to osteopenia or osteoporosis. I think most important nowadays is the concept that vitamin D is important for our immunity in fighting off infection. We talk about the flu season as if there's a bank of viruses waiting off the coast to come in November and attack us. Well, that's not really what happens. We as a herd, we've heard a lot about herd immunity lately, we as a herd become immunodeficient because we don't have the sun and the vitamin D. In fact, when this pandemic started in March, I sent my friend Tony Fauci a little email, how about vitamin D? And now he seems to have caught on that vitamin D deficiency does put people at a little bit of risk and is recommending that people take vitamin D. Now, vitamin D as a fat-soluble vitamin should not be taken as a white powder complex to calcium, because vitamin D is best absorbed if taken as a gel bead or a liquid and not as a tablet or a capsule. I personally like the Now brand, N-O-W. If you guys have your blood drawn here at UCSF, I can order a vitamin D level for you when we talk individually and we can see where you stand. I aim for people to have a level between 40 and 50. nanograms per milliliter. Each 1,000 international units of vitamin D raises you about 10. So if your blood test comes back like at 22, which is a very common number, I would say take 2,000 international units of vitamin D3. For people that have very low levels, I supplement with 50,000 units of vitamin D2 once a week for 8 weeks, just to fill up the tank. I really think vitamin D is important. It's also important for mood and for pain. So having a normal vitamin D level, I think, is a critical thing. And as I said, it's pretty much the only blood test that I order on patients that I see here at the Osher Center. Calcium I just mentioned. Calcium also important for bones, of course. Calcium lowers the risk of colon cancer, but may increase the risk of prostate cancer. So certainly for men, I recommend a lower dose of of calcium than I do for women, especially women over 50, because they are more prone to get osteoporosis and osteopenia. So I like calcium. Calcium, however, as I mentioned, should not be taken in the same capsule or tablet as vitamin D. Calcium can constipate, and magnesium does the opposite. So I usually recommend people take a calcium and magnesium supplement. Generally, they contain twice as much calcium as the magnesium. Some people like to take magnesium by itself because it's calming. And so they take that at night as opposed to in the morning when they take the rest of their vitamins. But calcium and magnesium are pretty much the basic minerals that I recommend. However, lately, because of COVID, zinc seems to be something that people are saying is good for your immunity. I remember at the beginning of the pandemic, when I went to the store to get some zinc, they were all sold out. You don't want to take too much zinc. I think 10 to 50 milligrams a day is probably adequate. And zinc is also good for prostate health. So that's another mineral that I like. A vitamin that I forgot to mention was vitamin C. Vitamin C is good for stress, and I like it with zinc for wound healing. So anybody who's going to have a surgical procedure, I recommend taking vitamin C and zinc for 2 weeks before and 2 weeks after to help with wound healing. Vitamin C is important for collagen, and it's also a stress vitamin. I took a course at the National Cancer Institute on nutrition, and something interesting that I learned was the body can only absorb 240 milligrams of vitamin C from any oral dose. So I see people who have taken 3 grams of vitamin C orally, and most of that is going down the toilet. So they used to make a 250 milligram size of vitamin C, but so few people buy that they don't make that anymore, and I have to buy 500 milligrams. But, you know, there is too much of a good thing too. For example, I've been extolling the powers of vitamin D, and at that National Cancer Institute session, I raised my hand after the vitamin D lecture because I said, it seems so wonderful, why don't we just put it in the water supply? And they said doses over 4,000 international units can lead to calcification of the aorta, your major blood vessel, and also the coronary arteries. So again, I see people taking 4,000, 5,000, 10,000 international units of vitamin D3 a day, and I say, that's probably too much. You have to be careful about your blood vessels. So one other, I mentioned B12. I like B12, again, for thinking, clarity, for nerves. B12 is an important vitamin. It's not well absorbed from the gastrointestinal tract, from the stomach. So I take my B12 as an under-the-tongue spray. There are also under-the-tongue B12s that dissolve so that you absorb it better rather than having it go through the stomach. Anybody who takes a lot of antacids, B12 doesn't get absorbed if you take antacids because it requires acid. So that's another indication for people to consider taking vitamin B12. Vitamin C, sorry, I'm jumping a little bit around back and forth. Many of my cancer patients want to take high doses of intravenous vitamin C. This has been a popular sort of alternative cancer therapy for many years. And I first was introduced to high dose intravenous vitamin C in the days of the early AIDS epidemic, where many people in San Francisco would go to storefronts where they would get infused with high doses of intravenous vitamin C in hopes that it would cure their disease. It didn't, and they all died. So that made me quite suspicious about people getting high doses of intravenous vitamin C for cancer. And my experience is that most of my patients who have done that have not actually survived, so I don't think it cures cancer. There have been some studies that say that it improves quality of life in people living with cancer. Well, I think people with cancer get enough infusions to begin with. I don't understand how getting an infusion once or twice a week is going to improve your quality of life. And I think there's a significant placebo effect there. So I'm happy with a little bit of vitamin C by mouth. I don't think we need to take high dose intravenous vitamin C. And before I open it for questions on vitamins and minerals, one other mineral that I want to talk about is iron. People are usually saying, gee, I got anemic from my chemotherapy, I'm going to take iron. Iron actually feeds cancer. That's one of the problems with red meat. It's rich in heme iron. If you're not iron deficient, you shouldn't take iron. Iron deficiency comes in women who are actively menstruating. Otherwise, it's usually seen in people who are having bleeding from either their gastrointestinal or their genitourinary tract. And chemotherapy doesn't usually cause that. So if you're anemic from chemotherapy, you're probably not iron deficient, and I would recommend not taking an iron supplement. So those are vitamins and minerals, A, B, C, D, and E, and then zinc, calcium, magnesium, and iron are the minerals that we sort of reviewed. Any questions on vitamins, minerals, thoughts, comments? Great question. So oncologists usually have two concerns about people taking supplements. The one just mentioned is antioxidant versus oxidation. So radiation works by creating free radicals of oxygen to knock in to the tumor DNA and kill it. Antioxidants work by taking those free radicals out of circulation. So a number of the vitamins that I mentioned, vitamin A, C, and E, are pretty potent antioxidants. I think I said last time that it's always okay to eat antioxidant-rich foods because if it comes down to that beam of radiation versus that blueberry, I think the radiation wins. But taking antioxidant supplements during radiation is not something I recommend, especially if we're giving the radiation with the goal to cure. Because those antioxidants could take the free radicals that the radiation is making out of circulation so they don't kill the tumor cells. Has that ever been proven? Well, there was a study in people with head and neck cancer, and again, they were being supplemented with either vitamin A or vitamin E. They stopped the vitamin A part when they found out about the beta carotene increasing the risk of cancer because so many people who get head and neck cancer also smoke cigarettes. So they continued with the vitamin E, and the vitamin E did decrease some of the adverse effects of the radiation, but it also made the radiation less effective, and more people got recurrent disease, and in a later analysis, more people supplementing with vitamin E actually died than those who didn't supplement with anything. So that's what makes radiation oncologists particularly staunch in their demand that people take nothing at all when they're getting radiation because they fear something is going to be an antioxidant and impede their treatment. Similarly, a number of chemotherapeutic agents also create those free radicals of oxygen. So my general advice is during chemotherapy, again, if we're going for cure, or if we're giving chemotherapy in an adjuvant setting, that is to prevent a recurrence, I would say let's hold off on the antioxidant supplements until you finish. The other thing that your oncologist worries about is an interaction between the supplement, usually a botanical, and the enzyme system in the liver that metabolizes pharmaceuticals. So some things, for example, grapefruit juice even, acts on this enzyme system and prevents it from breaking down the pharmaceuticals so that their level in the plasma will increase and they'll become more toxic. Other things ramp up this enzyme system in the liver. It's called the cytochrome P450 system. Some things ramp it up so that it metabolizes the pharmaceuticals more quickly and decreases their level, making them less effective. So that's why the default mechanism from your oncologist is basically don't take anything during treatment. And, you know, I don't think that's fair because you're fine to take your vitamin D, your calcium, magnesium. We're going to talk about omega-3s. I wouldn't take your vitamin A, C, or E, or perhaps some of the other more potent antioxidants. Melatonin, which we'll talk about, is some people consider an antioxidant, but I know many radiation oncologists who don't worry about patients using melatonin during their treatment. Good question. Thank you for asking. Well, another thing that we get from deep cold water fish is omega-3 fatty acids. So we have many different types of omega fatty acids. The most famous are 3, 6, and 9. So if you cut yourself, you want your blood to clot, and you want to get red, hot, tender, and swollen. That's inflammation. It's part of normal healing. That's what omega-6 fatty acids do. And the diet used to have twice as much omega-6 as omega-3. Omega-3s, as opposed to causing platelets to clump, break up clumps of platelet, and they're also anti-inflammatory, so against hot, red, tender, and swollen. Our diet used to have twice as much omega-6 to omega-3, but nowadays it's 15 to 1 or 20 to 1 in favor of omega-6. Omega-9 fatty acids are neutral, and that's what's present in olive oil, which makes that such a good oil for cooking. So because our diet has become so slanted towards the omega-6 side, I think people need some omega-3s. And omega-3s are available as oils or capsules. Personally, I don't like the taste of fish oil as a liquid, so I take a capsule. And people don't like omega-3s because they say they get fishy burps after taking them. I keep my omega-3s in the refrigerator and eat food on top of it. And keeping it in the refrigerator, even though it's not sold in the refrigerator section, and eating food on top of it decreases those fishy burps. You know, it's not only anti-inflammatory, but it's also a little antidepressant. And it's good for the brain. Women pregnant taking omega-3s, their children come out smarter or something like that. I don't know about that. In Ayurveda, the medicine of India, omega-3s are felt to be a bowel lubricant. Andy Weil, in his book Spontaneous Happiness, talks about treating his depression taking 4 grams of omega-3 a day. I personally take 2 a day, and I'm not depressed, but I just wanted to see what would happen if I took 4 grams a day. And I will tell you that it lubricated my bowel. It was easy and frequent, not loose or unpleasant, but definitely something I recommend to people who have trouble with bowel issues, especially if you're taking Zofran or ondansetron, which can constipate. So omega-3s have a lot of good uses. one study in men with prostate cancer, they brought them 5 grams of omega-3s a day and gave them a low-fat diet. And they didn't give the omega-3s to another group of men who had a standard diet. And at the end of 6 weeks, they all had their prostates removed, and the food had been delivered to them by chefs at UCLA. The men on the omega-3 supplement low-fat diet had smaller prostates, less cancer, and less aggressive cancer compared to the men eating the regular diet without the omega-3. And then there was a study that wasn't a randomized trial in people with lung cancer. And some people took omega-3 and they were compared to people who didn't take omega-3s. And the people that took the omega-3 supplements were able to tolerate more chemotherapy and seemed to have better outcomes. But again, it wasn't a randomized control studies. It was just this group took it and this group didn't. There may be other confounders as to what made one group respond better than the other. But I like omega-3s, and I do take my omega-3s daily. I like Nordic Naturals Ultimate Omega. And again, I keep it in the refrigerator. I say if you haven't taken them before, take 1 a day, and then if you want, take 2 a day. People who are vegan, I think there are vegan omega-3s available that are produced by algae. There are omega-3s in some plants, flaxseed and hemp, but that's alpha-linolenic acid, whereas the omega-3s in fish oil are EPA and DHA, very long names that I can't pronounce. And I think EPA and DHA are more potent omega-3s than the alpha-linolenic acid. So omega-3s are good. And again, inflammation, mood, bowels if you take enough. On the sheet that you got listing some supplements, I believe turmeric is there. And we talked about turmeric last time as a good spice that may have some anti-cancer activity. Turmeric also is good for inflammation and pain. So if you're dealing with pain and inflammation, I often recommend taking a turmeric supplement. Turmeric, as I mentioned last time, is not well absorbed from the gastrointestinal tract. So to get it absorbed for a systemic effect, anti-inflammatory, it usually needs to be modified or taken with black pepper or an ingredient in black pepper, piperine. Now, the problem with taking turmeric and black pepper is that that black pepper increases the absorption of everything else in the stomach at the same time. So I got into trouble taking turmeric with my alpha blocker that I take so I don't get up all night long to pee, which lowers my blood pressure. And when I started taking my turmeric with black pepper, my arthritis pain and inflammation went away immediately, but I woke up every night with a headache. And I said, oh my God, what's wrong? And it turned out that I was getting a low blood pressure headache because that black pepper was increasing the absorption of my prostate medicine. So for people that are taking temozolomide, I'm nervous about taking a black pepper supplement because it might increase the absorption of the chemo, and that wouldn't be a good idea. So there are other formulations of turmeric that are better absorbed that don't have black pepper. I think it's really a good anti-inflammatory. And again, just turmeric, the spice, seems to decrease the risk of colon cancer because as you eat it, it doesn't get absorbed well and it gets all the way down to the colon where it can do good things. So I'm a fan of turmeric and I do recommend it, especially if you have any inflammatory processes. Green tea on this sheet, I say drink green tea, don't take necessarily a green tea supplement. Green tea supplements taken on an empty stomach can damage the liver. So green tea and green tea extract and EGCG, which is the active ingredient, I would prefer people to drink the green tea and not take that as a supplement. Another antioxidant that I often recommend to people, especially if they've had radiation around the heart or take a drug that's damaging to the heart, is coenzyme Q10. Anybody who takes a statin to lower their cholesterol also needs to take coenzyme Q10 because CoQ10 depletes the muscle mitochondria. Statins deplete the muscle mitochondria of coenzyme Q10, which leads to some of the muscle problems that patients sometimes get if they're taking a statin. So coenzyme Q10 is also energizing. And so for patients who are dealing with fatigue, I, again, often recommend thinking about taking coenzyme Q10. It is a potent antioxidant, so it's not something that I would consider taking if you're getting radiation at the same time. But if you've had radiation, it may help with radiation damage. The other supplement that I often recommend to people is to take a probiotic. I consider chemotherapy to be a very potent antibiotic, cleaning out some of our good microbiome in our colon. So I suggest that people replace that by taking a probiotic. Again, I like a refrigerated probiotic because these are bacteria and they're sort of live, and I think they do better if you're sort of tamed down by being refrigerated until you take them. I like a probiotic that contains lactobacillus and bifidobacterium, and I'll put that in the chat box. And I don't think you need to take a probiotic every day, but again, a refrigerated probiotic with lactobacillus and bifidobacterium, I think is a good thing. There was a study done that showed that people who took a probiotic didn't do as well with immunotherapy. So that is something to be a little bit alerted to. Not sure why that is. I think we believe that these immunotherapies are quite dependent on your microbiome, the bacteria in your colon. And in general, it's been stated that people who eat a lot of processed foods and refined carbohydrates have funny microbiomes that make them less responsive to immunotherapy. Whether those are the people that took a probiotic to improve their situation or not is unclear. But if people are going to be destined to be treated with an immunotherapy, then I don't recommend a probiotic. But anybody who's had chemotherapy, I think probably would benefit from having a probiotic, especially if they have any gastrointestinal dysfunction. So probiotics I like. Sleep, sleep, perchance to dream. Very important, especially now, because if you don't sleep, your immune system is impaired. And I just read a little email blast about, I think they call it coronasomnia, which is, sleeping poorly during the pandemic. And I have to confess that I am a bit of a eternal optimist, and I don't worry about everything that's going on in the world during the course of the day, but I think it impairs my sleep. And so I found that I require something to help myself sleep. Melatonin. How many people have tried melatonin? I used to swallow it, 3 milligrams, and I would find that, oh my God, I couldn't get out of my dreams. They were really intense and I couldn't stop them. I would wake up and I would go back and I would be in the same dream. So Andy Weil told me, oh, you're taking it wrong and you're taking too much. So from now on, I take the 3 milligram melatonin and I bite it in half and I put it under my tongue and dissolve it about a half an hour, 45 minutes before I want to sleep. And that seems to work a little better with regards to not waking up quite as depressed and groggy as when I took it orally. So that's a little tip about melatonin. Again, I take about 1.5 milligrams. There's an investigator in Italy, Lissoni, who believes that people with brain breast, and lung cancers benefit from taking 20 milligrams of melatonin. He's the only person that has found that, and nobody else has really reproduced that. I don't recommend it. I do see patients coming to me who are taking 20 milligrams of melatonin. I said, how can you do that? I mean, I couldn't even do 3. They say, well, if you ramp up slowly, then you get used to it and it doesn't even make you sleep. Well, that's bad, I think, because melatonin is what our pineal gland produces to tell us that it's nighttime. And I think taking it during the day at 20 milligrams is going to upset your equilibrium a little bit. So I'm not a fan of 20 milligrams of melatonin. And again, one of the reasons that people do have difficulty falling asleep at night is if you watch television or if you're on your computer device or your iPhone or iPad, that light is read as blue light. And the reason we have a blue sky is to turn off our melatonin so we can function in the daytime. So blue light at night turns off your melatonin, and that's a reason people have difficulty falling asleep. So melatonin is a go-to for sleep. I like also Vital Nutrients is a company that you have to sort of sign up with, and then you buy their products online. They make something called Sleep Aid, which has 1.5 milligrams of melatonin, but also passion flower, lavender, theanine, valerian, California poppy, and hops or something like that. So 6 different supplements or botanicals in addition to the melatonin. And I find that's a very useful sleep aid. For people that don't like melatonin altogether, the company Gaia, G-A-I-A, also makes a number of different sleep aids, some that help you fall asleep, some that keep you asleep, and some that prevent you from waking up too early. I don't know how they really mastered that art, but that's what they claim on their site. I haven't tried any of their products yet. But sleep is important, and we'll talk about cannabis and sleep pretty soon when I get to cannabis. But before I got to cannabis, I wanted to do a little bit on mushrooms. So I think did everybody get the handout with the mushrooms? Yeah? Yeah. So I'm a big fan of medicinal mushrooms. You know, people say, gee, Donald, mushrooms, medicine, how could that be? So you know that you can take a mushroom and have a psychedelic experience, and you can take a mushroom and die. So obviously they have physiologic activity. So the cell wall of the mushroom resembles the cell wall of a bacterium. So if you take a medicinal mushroom product, your body gets fooled and thinks you're being invaded by a bacterium, and it mounts a non-specific immune response against that bacterium, which also maybe is going to work against cancer as well. So the first that we ever really had good evidence that mushrooms had some anti-cancer activity came from the prefecture in Japan, where they grow those enoki-taki mushrooms, or the enoki mushrooms, the thin white filamentous mushrooms that are in miso soup. And the farmers that grow those mushrooms had much lower rates of cancer than the farmers in the surrounding prefectures. And that's what led them to determine that there is something in the enoki-taki mushroom that, in addition to enhancing the immune system, also directly fights cancer. The reishi mushroom, considered the mushroom of immortality in China, called lingzhi, also has chemicals that are felt to be direct anti-cancer as well. The mushroom that's been most well studied, however, as an anti-cancer mushroom in both China and Japan is turkey tail, known as Trametes versicolor or Coriolis versicolor. And turkey tail, the Japanese use an extract called PSK, and the Chinese use an extract called PSP. I prefer to use the whole mushroom extract. That's why I like the company that I sent you pictures from the catalog, Host Defense. In the spirit of full disclosure, Paul Stamets, the owner, is a dear friend, and they do send me my mushrooms for free. So I need to tell you that. But I just think it's a good company, and I like their products. I visited their site in Olympia, Washington, and I think they do very good work. So most of my patients with cancer, I do recommend that they take turkey tail, which again is one of these woody polypore mushrooms that grows on tree trunks and is not particularly edible. A lot of people make a tea out of it, and as many of my Chinese patients make a tea out of their reishi or lingji, but I think taking it as a capsule is probably more potent. So these mushroom products come as alcohol-based tinctures, as capsules, or now as powders because so many people like to make smoothies. So turkey tail, I think, is a very good mushroom that has the most evidence that it has anti-cancer activity. However, I learned from a Chinese medicine practitioner that the body doesn't like to see the same mushroom every day. So I also like this Stamets 7, which is a blend of 7 different mushrooms that doesn't include turkey tail. So I tell people to get both of those, turkey tail and Stamets 7, and take 2 capsules of one or the other every day, but not both. Again, because the body doesn't like to see the same mushroom or the same thing every day. In fact, I stop all of my supplements for the last 4 days of every month, just to allow my body to clean out. And when I start taking them again on the first of the month, yay, they're back. So I like turkey tail alternating with Stamets 7. Another mushroom, or it's actually a fungus that grows on a caterpillar in the Himalayan highlands, is cordyceps, Cordyceps sinensis. The Chinese women relay team in 1980 broke all sorts of land records, and they were checked for doping, and the only thing they were taking was cordyceps. So cordyceps is oxygenating and energizing, and is also good for male vitality, if you know what I mean. So cordyceps is another mushroom that I have in my armamentarium, and I like to take at certain times, particularly when I feel low energy. A mushroom that I wonder about with regards to patients with brain tumors is lion's mane or hericium. This mushroom has brain-derived nerve growth factor, or it seems to increase it in the brain. So is that a good thing or a bad thing if you have a brain tumor? I don't know. But hericium is something that I recommend to my other cancer patients, particularly if they have neuropathy or chemo brain. Again, is it good or bad for people who have a brain tumor? The answer is, I don't know the answer to the question. And could we ever do research to answer that? Maybe, maybe not, I don't know. But it is a good mushroom, and it is also a component of the so-called mycobacterial, where it's called brain, which I took 2 of this morning. And this is reishi, lion's mane, and cordyceps. And it also has ginkgo, bacoba, and gotu kola. So it has 3 botanicals and 3 mushrooms together, and it really increases clarity. So those are medicinal mushrooms. People lately have also been asking me about psilocybin. So psilocybin, as you know, is a psychedelic mushroom. And there have been recent studies in patients living with cancer that showed that psilocybin can decrease anxiety, particularly anxiety related to possible death. And, you know, studies have been now published in the medical literature supporting that one psilocybin-assisted psychotherapy session can last for years in the future in improving someone's outlook and acceptance of mortality. So it's difficult to find psilocybin practitioners, but if you need one, I may be able to assist. So speaking of psychedelics, cannabis is not particularly a psychedelic. Cannabis has been around for probably at least 3,000 years as a medicinal intervention. Probably originated in China and then made its way along the Silk Route to India and then further west into the Arab nations, where it was used as a medicine for many centuries. It came to the United Kingdom finally in 1842, brought by W.B. O'Shaughnessy, who was a surgeon in the British East Indies Company, who saw all the healthful benefits that cannabis had. It made its way then to the United States, where physicians were able to prescribe cannabis to patients until it was removed from our pharmacopoeia in 1942. Up until 1942, patients could access medical cannabis. Now, obviously, we're in a tipping point where most of the states in the nation have cannabis available in some form or another. So the highest concentration of the most potent psychoactive component is found in the resin exuded from the flowers of the female plant of Cannabis sativa. And the most psychoactive component is delta-9 tetrahydrocannabinol, or THC. There are now felt to be about 140 other similar compounds in the plant that have similar shape to delta-9 THC, but may or may not have psychoactivity. And the one that's become probably the most famous lately is cannabidiol, or CBD. Since the last 78 years, when we haven't had cannabis available as a medicine, we've learned a lot about how cannabis actually works. And we've identified two receptors in the body, the cannabinoid 1 or CB1 receptor and the CB2 receptor. The CB1 receptor is the most densely populated receptor in the human brain. And when I ask a medical audience if anybody's learned about that in medical school, nary a hand raises. Actually, I just did a Zoom lecture and I asked people yes or no question, and there are about 50 people in the audience and 10% learned about the CB1 receptor in the brain in medical school. The CB2 receptor was initially identified in cells of the immune system. So why do we and all animal species down through sea squirts have this system of cannabinoid receptors? You've never seen a monkey smoking a joint. Well, just like we make our own endogenous opiates, our endorphins, we also make endogenous cannabinoids called endocannabinoids. The first was identified by Raphael Mechoulam, an Israeli chemist at Hebrew University, and he called it anandamide, after the Sanskrit word for bliss. One other endocannabinoid has also been identified. And these endocannabinoids complex with our receptors, the CB1 and the CB2 receptor. And when they do that, they change intracellular impulses that are controlling cell function, and they have many different results. Lower the pressure in the eyeball, decrease nausea or perhaps increase nausea with the new hyperemesis syndrome that's been identified, mood, sleep, all sorts of things. Now, interestingly, THC binds to that receptor. CBD does not bind to the receptor. And in fact, CBD actually changes the shape of the receptor so it can't bind THC anymore. So, you know, people always ask me, what is the best ratio of THC to CBD? Because products are available in our local dispensaries that have 1-to-1, 2-to-1, 4-to-1, 8-to-1. The answer is we don't really know, because the only product that has a known ratio of THC to CBD is a product that's not available in this country, but it's a whole plant extract of cannabis that's been modulated to have a 1-to-1 ratio of THC to CBD. And it's called nabiximols, and it's licensed and available in 20 countries, including the European Union, the United Kingdom, and Canada, for treatment of spasticity associated with multiple sclerosis. It's not approved in the United States yet because no studies that they've done here have demonstrated any benefit. It's also said not to make you high and not to make you hungry, which are things that real cannabis does. I believe that having a 1-to-1 ratio of THC to CBD, actually the CBD detracts from the psychoactivity of the THC and perhaps also from some of the potential therapeutic effectiveness. I was one of the members, 16 members of the committee that wrote the book, The Health Effects of Cannabis and Cannabinoids, for the National Academies of Science, Engineering, and Medicine. And in the single chapter on therapeutics compared to the 13 chapters on potential harm, we concluded that the strongest evidence is that cannabinoids are useful for chemotherapy-induced nausea and vomiting, as well as for pain, and for spasticity associated with multiple sclerosis. As I mentioned, however, we did find moderate evidence that cannabis was useful for sleep. So is it THC or is it CBD? You know, CBD has recently been approved in this country as a drug called Epidiolex for treatment of seizures in children with unusual seizure disorders, refractory seizure disorders, Dravet syndrome and Lennox-Gastaut or something like that. Interestingly, CBD is one of those molecules that affects that system in the liver that metabolizes drugs. And in the European Union, they only approved CBD for epilepsy in association with clobazam, an anti-seizure medicine, because they think that CBD blocks the degradation of pharmaceuticals so that the anti-seizure medicine builds up, and that's how it protects against seizures, not by any direct anti-seizure activity itself. So it's one of the concerns I have in patients I see who are trying to take highly concentrated CBD products to treat their cancer. Where does this come from that cannabis can treat cancer? Well, my friend and colleague Manuel Guzman at Complutense University in Madrid studies the effect of cannabis on metabolism. And the most metabolically active cells in the body are brain cells. So they would grow up rat brain in culture and add cannabinoids and do their work. And then they said, maybe we could do our research faster if we grew up a brain tumor. So they grew up a rat glioma, a brain tumor, and they added the cannabinoids and everything died. So they said, oh, we must have done something wrong. So they did it again and everything died. So they said, oh, maybe this is a bad batch of cannabinoids. So they went back to the normal brain and everything lived. So since that time, they have demonstrated that the cannabinoids binding to the CB1 receptor in the rat brain tissue cause the rat brain tumor cells to commit suicide. And they've also demonstrated that cannabinoids decrease vascular endothelial growth factor, which allows new blood vessels to form to feed the tumor so it can grow bigger, which is what bevacizumab does, commonly used in people with a brain tumor. And they also found that cannabinoids decrease the activity of an enzyme that allows cancer cells to become invasive and spread. So with all that evidence, where's the evidence that cannabinoids help people with cancer? And the answer is, there just isn't any in the published medical literature. Manuel Guzman went to Spain, to the Canary Islands, which is a Spanish holding, and he found 9 patients with recurrent glioblastoma. And he dripped THC by way of a catheter into their brain tumor cavities. And he found no benefit in the 9 patients who got the THC dripped into their brain tumor compared to those who didn't. And I told him, you know, we don't really treat brain tumors topically. So subsequently, the company that makes nabiximols, the 1-to-1 whole plant extract under the tongue spray, did a study of their medicine versus placebo in 21 patients with recurrent glioblastoma. They reported their results as a press release in February of 2017 and at the American Society of Clinical Oncology meeting in June of 2017, but it has not yet been published in the medical literature. What they reportedly found was that in the 12 patients with recurrent glioblastoma receiving temozolomide using the nabiximols, they survived, their 1-year survival was 83%, compared to the group using placebo, 9 patients using placebo with temozolomide, their 1-year survival was 54%. And that difference was statistically significant. However, we have not yet seen this in the medical literature. So patients often ask me, what is the right ratio of THC to CBD that I should use? And I say the only ratio that there's any evidence for in the medical literature is 1:1. And that did show some benefit in patients with recurrent glioblastoma. So what does it mean? I don't know. Do I recommend it? Maybe. If I always say if cannabis is going to work against any cancer, it's maybe going to be against a brain tumor because of the dense population of the cannabinoid 1 receptor in the brain. So how do we take cannabis? So everybody's aware of smoking, and now there are many different other options. When you inhale THC in cannabis, the peak concentration is reached in 2.5 minutes and then declines very rapidly after that. If you take THC by mouth in a baked product, for example, or in a capsule, it takes 2.5 hours to reach a much lower peak. And when you take it by mouth, when the delta-9 THC goes through the liver, it gets converted by that enzyme system into the liver into an even more psychoactive metabolite, an 11-hydroxy THC. So I see a lot of people, particularly older women with cancer, who think that inhaling is bad, but eating is good. So they go to the dispensary and they're told, only eat a quarter of the cookie. And they do, and nothing happens. So they eat another quarter and nothing happens. So they eat the whole cookie. And then they call me 3 days later, maybe after a visit to the emergency room, with a dysphoric reaction saying, I'm never going to do that again. So I tell people, if you want better control over the onset, the depth, and the duration of the effect, inhalation is probably better than oral ingestion. And when I say inhalation, I don't think there's anything wrong with smoking cannabis as long as you don't put tobacco in it. I think a water pipe is good, and also a vaporizer. I am an oncologist, so I'm pretty conservative. I know the long-term effects of inhaling a plant material. I don't know the long-term effects of inhaling an oil. So I say vaporizing, particularly to distinguish it from vaping, which has come to mean inhaling an oil. I don't think that's good for you, and I think the data bears that out. Nowadays, there are tinctures and oils. So if you put something in your mouth, when it sits there, it gets absorbed immediately from under the tongue. And then if you swallow it, then you get sort of a hybrid kinetics of inhalation and oral ingestion, because some that gets absorbed from under the tongue has an immediate effect, and the rest has the more delayed, prolonged effect. So I think tinctures and oils are a good thing. And that's what I generally recommend for most people if you don't want to inhale. I do think vaporizing or a bong are okay, and there doesn't seem to be any downside to that. It doesn't increase the risk of lung cancer, doesn't increase the risk of COPD. People who smoke cannabis a lot may have a little bit more cough and mucus, but that's all that we can find that's bad. Cannabis also has 2 major species, Cannabis sativa and Cannabis indica. Cannabis sativa is felt to be mental and uplifting, and Cannabis indica is more of a body effect and more of a sort of calming or downer. So if you're having trouble sleeping, I don't recommend sativa, because that's going to get you wired. If you have trouble getting motivated and being energetic, then indica would not be the one to take. Most of the blends that are available in the dispensary are actually a hybrid of both sativa and indica. It's rare to get totally one that's dominant indica or sativa. Now, because there's so little in the medical literature about CBD, we did a little survey here and in Chicago and San Diego of patients in our 3 integrative medicine clinics, as well as 10 dispensaries in those cities using CBD dominant products. That is a greater than 1-to-1 ratio of CBD to THC. And we asked them what they were using, how they were using it, what for, and if it worked. And the respondents were predominantly older women, high socioeconomic level, using it for pain, anxiety, and sleep. And it reportedly worked 8 out of 10 on the scale. So, you know, I am not a CBD proponent, but I will confess that my husband, Clint Werner, wrote the book Marijuana Gateway to Health, How Cannabis Protects Us from Cancer and Alzheimer's. And he gets a lot of free samples. He also judges for High Times Cannabis Cup. So I must say that I do use a little CBD product at night for sleep. People juice cannabis. Cannabis juice doesn't contain the carboxylated active CBD and THC, but contains the acid form, THCA and CBDA. And actually, the product that I'm most liking at night for sleep is a CBDA product. I'm not as crazy about the CBD. So there are a lot of products out there, and there's a lot of confusion about what works and what doesn't work. A few years ago, 2 PharmD graduates from UCSF came to me and said, what would you think if we opened a dispensary run by pharmacists? I said, that would be a good idea. So they came back a year later and they said, guess what? It cost $1 million down to open a dispensary in San Francisco. So instead, we opened a concierge cannabis practice. And I'm going to put this in the chat box as well. And I will say that just FYI, in the spirit of full disclosure, they want me to be an advisor to them, but we have no financial relationship at this point in time. So I feel comfortable recommending them. So what they do for a $99 fee is they talk to you and find out what it is you're trying to treat. And they ask you what else you're taking and what your diagnoses are. And they then will recommend for you a product that they think would work best. For extra fund, they will also send you a tincture that they believe is the best product for you so that you don't have to go deal with a dispensary. So those are my comments about THC and cannabis. Let me say that although I'm not a fan of cannabis as an anti-cancer agent, I think it's very useful for symptom management. Again, nausea, appetite, pain, anxiety, depression, and sleep. And instead of recommending 5 different pharmaceuticals that I have to write prescriptions for that all may interact with each other or with my patient's cancer treatment, I can recommend that people try one product, and that's cannabis. Clint and I have a big fight, by the way, as to whether it's cannabis or marijuana. I call it cannabis because that's what the official name is. Marijuana is what Harry Anslinger used in 1937 when he introduced the so-called Marijuana Tax Act, which made cannabis illegal in this country. He used the Mexican word for the plant to do an end run around physicians. So, and he was reportedly a racist who thought that widespread use of cannabis by Mexican-American migrant laborers and African-American musicians was going to lead to increased crime and mental illness. So I won't call it marijuana, but Clint thinks it's racist not to call it marijuana and says we don't call broccoli brassica. So why do you call marijuana cannabis? So it's another one of our little spousal fights, but what can you do? You know. Vaporizing is fine. Vaporizing, they have little we study the so-called volcano vaporizer, which is a tabletop thing that blows up a and it's huge, but they have handheld vaporizers as well. With the plant product, the vaporized plant product, not oil. Putting an oil into your lungs cannot be good for you. I mean, mushrooms, you know, many oncologists are really fearful that mushrooms are going to damage the liver because of the old fear that, you know, people take mushrooms and it damages their liver and they die. Cannabis, you know, the only concern that I have, as I mentioned, is the interaction with that enzyme system in the liver that metabolizes other pharmaceuticals and other botanicals. And we've done studies with protease inhibitor drugs for treating HIV and for sustained release morphine and oxycodone in conjunction with inhaled cannabis, and saw no detrimental effects via that liver system. But I don't think cannabis is going to damage the liver cells like other drugs that we use pharmaceutically might do. I've never heard of that happening. If I had a brain tumor, I might take a one-to-one product on sort of a regular basis, just because of the data from the study that has not yet been published, that the nabiximols increase 1 year survival in a statistically significant fashion. So the number of people, when they started the study, 12 people got the spray and 9 people got placebo. And at 1 year, 83% of the people that got the treatment were alive, compared to 54% of those who got placebo. Now, you're right, in the second part of the question, they said that the survival of the group that got placebo was 366 days, and the average survival of the group that got the spray was 590 and counting. And that's why they said that they were waiting to write the paper, because they wanted to see how much more survival that group had. I don't know if that's right or not, because I haven't been able to read the paper because it's never been published. But yeah, it's not only the number of people who crossed that 1 year finish line was increased, but the people obviously then are living longer if more of them are crossing the finish line at 1 year. I just reviewed clinicaltrials.gov. My friend Manuel Guzman is doing another study in Spain that hasn't started yet. I think it's going to start next month, for brain tumors, looking at, I think, THC alone, THC, CBD, maybe CBD alone, extracted from the cannabis plant. And it's been manipulated to have a 1-to-1 ratio of THC and CBD, but it also has all the other chemicals in the plant. It's a good medicine, but it's not yet available in this country. As I said, if it were me, I might take a product, if I could tolerate it, that has a 1-to-1 ratio.
Wonderful. Well, thank you so much. Thank you.
Yeah.
Thank you, everyone.